Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Words of Wellness. I'm your host, Yassir Al-Manawi, a clinical therapist. Today we are going to be talking about daily activities in relation to the treatment of depressive episodes, in relation to the treatment of some kind of obsessive-compulsive neurosis or obsessive-compulsive thoughts. Why is daily activity very important? It is very important because it prevents isolation, it prevents negative self-talk, and it prevents our own thoughts all day long about ourselves, about negative issues that goes on in ourselves. And it also prevents our thoughts from consuming negative issues from the society around us and bringing it to ourselves. So basically, we try to prevent or eliminate idle time. Idle time is a door for a lot of diseases, psychological diseases, and emotional imbalances. So let's see, we have a surah, an ayah from the Quran. We're going to read the translation, and we're going to get back right into our discussion. It is Surah Al-Isra, ayah number 12. And this is how the translation goes. And we have made the night and the day two signs. The sign of the night we have cancelled, while we have made the sign of the day light, that you may seek bounty from your master, and that you may know the number and count the years. Likewise, everything have we fully explained. It's actually very, very important that we take a look at that. And it's very important that we act accordingly. So let's see. If now we have somebody, God made day and night. We know that night is for taking a rest and sleeping and regenerating yourself. And the daytime is to work and to gain everything that you can gain. Not only material stuff, not only money, but you also use it to gain knowledge. You also, and you know, we are urged to gain the knowledge too. So let's talk about the people who spend the daytime sleeping and the nighttime sleeping, or the nighttime awake and the daytime sleeping, and you know, days become night and night becomes day. Most likely, a lot of these people, what you find out is that they become unbalanced, emotionally unbalanced. How? A form of isolation is what? Sleeping. Usually what we say, somebody might run away from daily life into what? Into sleeping. By sleeping, what happens is that people lose their self-confidence. And it turns into a lot of issues, which result in what? It result in depression at the end. And therefore, we're going to discuss depression very soon. There are two types of depression. You have situational depression and you have clinical depression. Because a lot of people, when they get depressed, what they want to do is that they go to a psychiatrist. They say, well, okay, that's it. I need help. I need to go to seek some help with a psychiatrist. And they think that taking a pill is going to make everything okay. No, taking a pill isn't going to make everything okay. Taking a pill is going to assist somebody maybe to move and do what they were asked to do what they ought to do what they are supposed to do as human beings. And what is that? That is to be active with everybody on a daily basis. That is to schedule yourself on a daily basis, as you know, like things to do for the day, and then whenever you do something, check, you do something, check, you do something, check. That way, you have two benefits of it. The first benefit is that your self-confidence and self-satisfaction will actually increase. The second thing is that you are going to be too busy to keep thinking about negative issues and get out of yourself. That's the second thing. And then you will actually be liked by other people. You will have more friends. You will have more people that will pull you out of this depression that you're in. We talked about the two types of depression, but I didn't mention what it is exactly. Clinical depression is chemical imbalance, and that is treated by the pills, by the medication. Excuse me. The other type of depression is a situational depression, which means somebody might get depressed as a result of a certain situation. It could be a loss of work, it could be a loss of loved ones, it could be any kind of loss, or it could be anything, any traumatic experience that could cause depression. During the second, or in the second type of depression, the situational depression, what we do is that we treat it also by pills, by medication in the beginning, with the psychotherapy, until they are able to move and move their energy and move their body, because moving the body changes the chemicals inside the body. It changes the chemical makeup inside the body. By the change, you'll find out that the need for the medication might decrease or subside, or you may not even need medication after that. So there are huge differences between clinical depression and situational depression. The clinical depression is chemical imbalance, biological. It's just there. It could be organic. So that needs medication at all times. Somebody might come and ask me, say, okay, now I was depressed and I don't feel like I want to live anymore. A lot of people connect that the suicide is connected closely to depression. Well, there is a relationship, but it's not a tight relationship. Suicide comes from somebody who's given up on life totally, not depressed because of an episode or because of something that's going on wrong with their lives. So it's actually suicidal ideation is something that needs to be watched closely. And it doesn't necessarily have to, you don't have to have depressed mode or indications to have suicide thoughts. It could happen all of a sudden for certain people, and that's because of other things that they have to deal with from early childhood experiences and traumatic experiences. That's why we need to make a difference between those three diagnoses. So let's get back to what we were talking about doing what you're supposed to do on a daily basis, being active, being interactive with people, because not only active but interactive with people, it's a give and take, it's a relationship. That in itself is a technique in treating depression, because when we treat depression we talk about what? Cognitive behavior modification therapy. Cognitive means the cognition, which is I challenge their negative thoughts. Behavior modification, which is the daily behavior. They have to change from sleeping all day or not doing anything all day into being active. And that's exactly what we are talking about. When in the daytime I have to seek knowledge, I have to work, I have to do everything that everybody does, that I'm supposed to do, that I'm ought to do. And at nighttime I have to get my rest, because it's very important to get the rest too. It could be leading to depression and other emotional imbalances if you don't get enough rest. With that, I'll leave you for today, and we'll meet again in a different episode, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.